Hi, I'm Dr. Carolynn Francavilla. I have a primary care practice that I own in Lakewood, Colorado. And today I wanted to talk about how to utilize telehealth in your practice with the novel coronavirus. I am seeing a lot of people ask questions on social media about how they can use telehealth in their practice. So I wanted to take a few minutes to share with you how you can do that. So we're going to go through some basic telehealth rules and practices and how we use it generally. We'll talk about payment for telehealth, and then finally talk about how you might be able to implement it right now for the novel coronavirus in order to get your patients the right level of care. Telehealth is something we've used in our practice for a little more than 3 years. Basic telehealth things you do need to know. A patient needs to be actively in the state you have a license for you to do telehealth. So I can be in any state I want when I'm performing telehealth, but the patient needs to be in a state I'm licensed in. I only have a license in Colorado, so my patient should be in Colorado when I'm doing that appointment. I can be anywhere. I can be in Hawaii, I can be in Texas, but the patient needs to be in Colorado where my license is. Your notes and documentation are going to be the same as they always would be. So you are going to write down an HPI. You are going to put a physical exam, what you can see in front of you. So for me today, you might say that I appear like I am in no acute distress. I have good color. Maybe I have mildly pressured speech. You might be able to have the patient show you a rash or something on their arm. You may ask them to describe some physical findings. So you may have them look in the back of their throat. Do they have redness, swollen tonsils, exudates? They may be able to describe some of that. Perhaps they have equipment at home and can check a blood pressure, a pulse ox, or something else, even a temperature. And so you would record any of those items as appropriate. You really want to make sure you're providing appropriate care. So if from the beginning the complaint doesn't seem appropriate from telehealth, let your patient know that. And if at any point in the encounter you think that you need to see them in person or need them to have a higher level of care, you just need to be honest with yourself and with your patient about what you can safely do by telehealth. The way we specifically utilize telehealth is we use the platform Zoom. We pay for a HIPAA compliant version of that. And what I do is I usually set the laptop right in front of me on my desk. I'm usually in my clinic when I do telehealth, and I have my desktop off to the side, and I'm just looking at the patient's chart, taking notes, just like I normally would. And that's sort of the basics on telehealth and how you do it. Telehealth refers to synchronous audio and video. So you're going to be using something where the patient and you can speak in real time. So again, we use that platform Zoom, which looks a lot like Skype to people. And what we do is we just send them a link for the appointment. So we have the platform. When they schedule the appointment, we email them the link of what time they're at, some basic directions of what they're going to do, a reminder to log in ahead of time, make sure that they have activated their audio and their video device on their phone or computer that they're going to be using, or that they've downloaded the Zoom app ahead of time if that's what we're using, and give them the link of how to do it. And then we copy and paste the link into the HPI for that encounter so that the doctor can always go ahead and find that link to start the appointment. And then I also have the Zoom app on my phone and on my computer so I can see all my Zoom appointments for the day and just click on the appointment for that time. And then we just label the appointment time with the patient's initial. So I'm Carolynn Francavilla. The appointment would just be labeled CF so that we know which person we're seeing. So that's how we've logistically utilized it. Doctors always want to know about payment. We all have to stay in business. We can't do anything for free, right? And so people always ask, do you actually get paid for this? The answer is that depends. So we are in Colorado where there is parity for telehealth, meaning telehealth appointments have to be paid at the same rate as a regular encounter. There's a few carve-outs and exceptions, but for the most part where we're at, private insurance pays the same rates as does Medicaid. When you bill the same way you normally would. So you're billing a 99213 or 99214, usually one of those two based on complexity or time, just like you normally would as appropriate. You do have to add some modifiers. So to that CPT code, you're gonna add a modifier of a GT, and you may have to add an originating site of a 02. So that might be something to talk to your biller about, but if you're getting started on this today, that's my advice on how you would bill for the most part. Medicare has traditionally not allowed telehealth for most people. There were some exceptions for rural locations. We were not previously able to bill Medicare, but one thing that has happened in the last week with the novel coronavirus is that there has been legislation to allow Medicare to pay for telehealth. The requirements of this is that it does need to be during a state of emergency, and you need to be in that emergency area. So for us in Colorado, that would apply, and that may apply to you at some point as well. And then it does need to be an established patient. So it needs to be a patient that you have seen in the last 3 years and have an established relationship for the Medicare. Traditionally, you may not have to have an established relationship to do telehealth with other insurers. That is probably going to be state dependent if you do need to have an established relationship for telehealth or not. We're able to do new telehealth appointments where we're at. Okay, so we've talked about the basics of telehealth, how to get paid for telehealth. It's not as complicated as you think. It's really just adding that modifier to your visit and writing a note and doing an encounter like you normally would. Let's talk about how our practice is currently implementing telehealth for the novel coronavirus or COVID. So we already have been utilizing telehealth, and we have expanded it in the last week to be able to meet the needs of our patients. And I think there's a few reasons to do this. I think we all know we need to keep people who are not sick out of the emergency rooms. We need to save emergency rooms in hospital for the people who really need them. And we also want to keep mildly sick people out of the general public so that we don't continue to spread this virus. So what we're doing on our office is we are starting all sick visits as telehealth appointments. So if anyone has a fever, respiratory complaint, or any possible concern that they could have coronavirus, we are going to start that as a telehealth appointment, which so far has been working really well. And if we do that encounter, we'll do one of 3 things. We'll either say, sounds like you have a mild viral illness. We don't know if it's coronavirus or not, but go ahead and stay home for the next few days. Contact us if anything gets worse at any point. Here are your warning signs: severe shortness of breath. Go to the emergency room. You can call us first if you're not sure. We may triage them that we need to see them in the office. So last week I had someone who had shortness of breath. He had a history of asthma. He had no risk factors for COVID. And I actually had him come by the office at his convenience later that day, listen to him, confirmed he had an asthma exacerbation, and treated him appropriately. In that case, I just billed the visit as a regular visit as opposed to a telehealth visit, because now I've seen that person in person. I just happened to do the documentation by a telehealth encounter earlier in the day. So that may be an option that we have them come in. For people with respiratory complaints, we're going to now try to do all of those visits by car. So we were able to get our building to designate a parking spot for us, and our patients will park in that parking spot. If they're sick, but we don't think they have COVID, but we don't want them spreading their germs, we could go down, do a quick exam, get vitals, possibly do a flu test, maybe at some point if we need to do coronavirus testing, we would do that as well. And then the third option would be that we see that person by telehealth, we look at them, we hear their story, we think that they're ill enough that they do need to go to the emergency room, and that would sort of be that third level of care. In Colorado, we do actually have one location where we can send people to do a drive-by COVID testing as long as they have an order from us, and so that would sort of be in that middle triage too of maybe we don't need you to stay home, we do need to do testing, here's where we're gonna send you. And right now in Colorado, we're just making that order really simple. We're gonna handwrite it, take a picture of it, email it or text it to the patient so they'll be able to bring it with them to the health department to get their testing done. So that's a summary of how we're utilizing telehealth. So we've used it again for 3 years. We traditionally have used it for a lot of mood follow-ups, labs, but sometimes it's a person who just can't get in an office. I had a person who insisted on doing a telehealth appointment with me several months ago. They showed me their arm. They clearly had an abscess, but I had everything documented, ready to go. They came by the office at the end of the day. I lanced the abscess, got them in and out in, 5 or 10 minutes, and their note was already done. So it didn't really add any additional burden for me. So that was a simple way that we were able to use telehealth to help a patient access care. And I think now we all need to be doing those sorts of things. We need to keep people home if they don't need to be out and about. We need to keep sick people home, but we still need to be there to reassure our patients and help them make sure they're getting the right level of care. Primary care is going to be really important in this COVID battle. And so one thing we can utilize is telehealth, and we can get our patients triaged through telehealth into the appropriate place and see a provider that they know and trust. And we know them. We know if they look sick, we've seen them before. We know what their normal is. Thanks for listening to me. I hope that's helpful and that you will consider implementing telehealth in your practice.